Have you ever wondered how many people around you snore and how it affects their daily lives? Snoring, a ubiquitous phenomenon, is something that many of us are all too familiar with. Whether it's coming from a family member, a roommate, or even ourselves, snoring is a common thread that ties together the quiet hours of the night. In fact, it's estimated that approximately 45% of adults snore at least occasionally, while 1 in 4 are habitual snorers. But what does this mean for us? How does snoring affect our lives and the lives of those around us? Well, the impacts of snoring extend far beyond the nighttime hours. It's not just about disturbing the peace of the night. Snoring can affect the quality of sleep for both the snorer and those who share their space. This can lead to daytime fatigue, irritability, and even health problems over time. For the individual who snores, the constant disruption of sleep can lead to a host of issues, from simple exhaustion to more serious conditions like heart disease. For those who share their space with a snorer, the nightly noise can lead to sleep deprivation, which can affect everything from mood to productivity. Snoring is a global issue, affecting people of all ages, genders, and backgrounds. It's not just an adult problem either. Children can snore too, and this can impact their growth, learning, and behavior. The importance of understanding snoring cannot be overstated. It's more than just an annoyance. It's a health issue, a relationship issue, a quality of life issue. It's something that deserves our attention and understanding. As we delve deeper into the world of snoring, we'll explore the science behind it, the range of severity, and the factors that can influence it. We'll also discuss how it's diagnosed and what can be done to manage it. So stay with us as we unravel the mystery of snoring, one breath at a time. Snoring may seem like a harmless, albeit annoying habit, but it's more than just noise. But what exactly is snoring? Let's delve into the science. Snoring is essentially a sound resulting from turbulent airflow that causes the tissues of the nose and throat to vibrate during sleep. It's like a flag fluttering in a stiff breeze, but instead of the wind, it's your breath. And instead of a flag, it's the soft tissues of your upper airway. Now let's visualize this. Picture the pathway air travels from your nose or mouth into your lungs. This path is like a high-speed highway for air molecules. During the day, this highway is wide open, allowing air to flow freely. But at night, things change. As we drift into sleep, our bodies transition into a state of relaxation. This includes the muscles in our throat. As these muscles relax, they can partially block the airway. The once broad open highway now becomes a narrow winding road. This narrowing of the airway causes the speed of the air we breathe to increase significantly, much like when rivers narrow into rapids. The increased speed results in turbulent airflow. The turbulence vibrates the floppy, relaxed tissues lining the airway, and voila, the infamous snoring sound is produced. Now, it's important to understand that snoring is a spectrum. Everyone snores occasionally, and light, infrequent snoring is usually not something to worry about. It may simply be a result of sleeping in a certain position or temporary factors like an allergy or a cold. However, frequent heavy snoring could be a sign of a more serious condition, such as sleep apnea, where breathing repeatedly stops and starts, leading to poor quality sleep and affecting overall health. Age, too, plays a role in snoring. As we grow older, our throat becomes narrower and the muscle tone decreases, which can lead to increased snoring. So, to sum up, snoring is a complex phenomenon resulting from the interaction of airflow, muscle relaxation, and the physical structure of your airway. Sounds simple, right? But the story doesn't end here. Snoring isn't a one-size-fits-all situation. Indeed, the world of snoring is as diverse as the people who experience it. Each snore unique, each breath a testament to the spectrum of this nocturnal symphony. Let's start with the occasional snorers, the ones who only awake in the house when they found that particularly uncomfortable position on their back or when they're battling a bout of the common cold. This type of snoring is typically benign, more of an annoyance than a health concern, but it's an important part of the spectrum nonetheless. Next, we have the age-related snorers. As we age, our bodies go through natural changes, including a decrease in muscle tone. This loss of tone can cause the throat muscles to relax more during sleep, leading to more frequent or louder snoring. It's not necessarily a sign of a sleep disorder, but it's a reminder of how our bodies continue to surprise us as we age. Then we shift into a more serious territory. We're talking about primary snoring and snoring associated with sleep disorders. Primary snoring, also known as simple snoring, is snoring without any associated sleep disorder. It can be chronic and it can be loud, but it doesn't typically lead to other health problems. On the other hand, snoring associated with sleep disorders is a different ballgame. This is where snoring becomes more than just an annoyance. Conditions like sleep apnea, where breathing is interrupted during sleep, can lead to chronic or severe snoring. And it's not just about the noise. These conditions can have serious health implications, including increased risk of heart disease and stroke. And let's not forget about the role of underlying medical conditions. Obesity, nasal congestion, and other health issues can lead to chronic snoring, adding another layer of complexity to the spectrum. So whether it's an occasional snore or a nightly symphony, whether it's a simple annoyance or a sign of a deeper health concern, snoring is a spectrum. And on that spectrum, each of us has a place. So not all snores are created equal. How we live our lives can influence our snoring. Ever noticed how a night of indulgence can lead to some serious serenades from the back of your throat? That's because lifestyle choices like alcohol consumption and smoking can exacerbate snoring. Alcohol, for instance, acts as a muscle relaxant and can cause the tissues in your throat to slacken more than usual during sleep, leading to louder and more frequent snoring. Similarly, smoking irritates the nasal and throat tissues, causing inflammation and congestion, which can lead to snoring. It's not just about what you consume, but also about your general lifestyle habits. Regular exercise and maintaining a healthy weight can reduce the chances of snoring, as excess weight, particularly around the neck, can narrow your airway and increase the likelihood of snoring. So if you're a chronic snorer, it might be time to reassess your lifestyle choices. Remember, your lifestyle choices can literally keep you or someone else up at night. How do we find out if your snoring is a symptom of a bigger problem? If you've ever asked yourself this question, you're not alone. Thousands of people around the world grapple with the mystery and challenges of snoring. The process of diagnosing snoring is multifaceted and involves a comprehensive evaluation of the individual's medical history, physical examinations, and often sleep studies. Let's delve into this a little deeper. Firstly, a detailed patient history is crucial. This includes understanding the severity and regularity of the snoring, any known triggers, and potential sleep disturbances. It also involves assessing lifestyle factors such as alcohol consumption, smoking habits, and potential medication side effects. Next, a physical examination is conducted to assess the anatomy of the upper airway. The doctor will examine the nose, throat, and mouth for any abnormalities which could contribute to snoring, such as enlarged tonsils or a deviated septum. Finally, sleep studies, also known as polysomnography, may be recommended. These studies monitor various physiological parameters during sleep, such as brain waves, eye movements, and oxygen levels in the blood. This helps in identifying any sleep-related breathing disorders that might be causing the snoring. In some cases, specialized tests like a CT scan or MRI may be required to further evaluate the airway anatomy. These diagnostic steps combined provide a comprehensive assessment of the individual's snoring and potential underlying causes. Remember, diagnosing snoring isn't just about listening to the noise. It's about understanding the root cause, and that starts with a thorough evaluation. What can you do if you or someone you care about snores? Well, managing snoring often involves a combination of medical interventions and lifestyle changes. Firstly, a visit to a healthcare professional is crucial. They can help identify any underlying conditions contributing to the snoring, such as sleep apnea or nasal congestion. Medical interventions can range from simple nasal strips that widen the nostrils to more complex procedures, such as surgery, depending on the severity and cause of the snoring. Lifestyle changes can also play a significant role in managing snoring. Maintaining a healthy weight is key, as excess weight can increase the likelihood of snoring. Regular physical activity can help with this, and it can also contribute to better sleep overall. Diet also matters. Avoiding large meals close to bedtime and reducing alcohol consumption can prevent the throat muscles from relaxing excessively during sleep. Similarly, Quitting or reducing smoking can alleviate nasal and throat congestion, thereby decreasing the chances of snoring. Sleep position can influence snoring too. Sleeping on one side rather than on the back can help prevent the tongue and other soft tissues in the throat from collapsing into the airway. In conclusion, managing snoring is a multifaceted approach that requires both medical advice and personal commitment to lifestyle changes. Remember, snoring doesn't have to ruin your nights or your health.